3,
2, 1, yep.
Hello, my name is James, and today is the 25th of March 2019, and we're going to go through how we set up a dental at my clinic. So we already have our anaesthetic monitoring set up, which is pretty standard. We've gone through that in some previous videos. Here we have our absorbent pad to catch liquids and everything coming out of the mouth for a simple scale and polish. Our ET tube for the patient, a pharyngeal pack to go down the back of the throat so it doesn't block. So it does block, so no fluids can go behind it. We have our neck elevator here, so the neck is placed there and the head is there, as to make sure that an extra barrier in case no fluids go behind the throat. We also have our heat mat and our positioning aids to make sure that the patient doesn't roll off the heat mat. Over here on our portable trolley, we have our dental tools, which I'll go through in a moment. We have our sharpening stone for our dental tools. And there, we also have our PPE, so we have a waterproof apron, as well as goggles, gloves, and a face mask. They're all just to protect from flying debris, potential contaminants, and the face mask does also help with some smell on your higher grade dentals. So in the instruments here, this is where we keep them. We have a couple of extractors. These are used to extract teeth. So we'll have some deciduous extractors and some normal extractors. We do have a wider range, but this is what we need for today. We have a dental mirror, which can be used to angle underneath and show behind teeth where we can't see. Also makes it easier so the vet doesn't have to crouch down. We have our mouth gag, which are placed on the top and bottom canines, used to open the mouth. They have 2 rubber stoppers on the end to make it a bit easier for the teeth. We also have a range of normal elevators and deciduous elevators here. We have some winged ones, and we also have more flat ones, such as this one. The vet will choose which ones to use, and they are just to separate the ligament from the tooth to make it easier to extract, sort of elevate it in a way. Sally's work is you'll grab the one you desire, go down, go through the subgingival and sort of separate the ligament that attach the tooth. As a nurse, I'm not permitted to do that. And then we have our range of scalers here. So it just depends on the vet's preference. These are all hand scalers, some are for cats, some are for dogs. This one our vet would prefer to use on a cat specifically, whereas these two she'd prefer to use for a dog. And then we have our peri probe. So you can see the slight lines on that. So this tests the pocket of your teeth, with the 1 to 3 mils being acceptable on a dog. This can check how much of a gap is there. This one is also another little peri-probe. You'd more use that for your molars, as well as it can also be used as a scaler, but that is not exactly recommended. Maintenance for all of these is the same. They all get washed in Medazyme. Leave left for the time that they're supposed to be washed for. Then dried with a lint-free cloth because we don't have a drying cupboard, and then they are autoclaved separately, and they are stored in this case. And then finally, we have our dental machine. So we'll have our ultrasonic scaler, which is used for scaling teeth. That will use demineralized water, which we've filled up at the back. This hub here sort of controls your ultrasonic scaler. has an on and off button on the back. Then we have our polishing head here, which we use our toothpaste on, and it polishes the teeth, removing any excess plaque on the top. Then we'll go to here, which is our dental drill, or that uses our burrs, which we have here. We don't have this set up because today we are just doing a grade 1 scale and polish. On a young healthy dog doesn't seem to be need for extractions at the moment. To go between these two, we have our selector here. So for low speed will be this, because we do only have one foot pedal. So on low speed, if I press down the foot pedal, the head of the polisher starts to rotate. And then if I step down on the pedal here, if there was a burr in there, that would start to rotate and water would come out there if that was on high speed. And then finally, for our final clean, we have this bad boy, which will spray out air on one button, and it will spray out our CLS solution. So the CLS solution, which is in the brown bottle, don't know if you can see that behind there, is diluted with distilled water, as well as what our white bottle is filled with, or our clear bottle is filled with, and that sprays the CLS solution down into the mouth of the patient to remove any extra debris, get rid of that gunky feeling in the patient, and then you can also air it out. This machine, this whole generator and compressor is maintained once a year. It was done recently, so there is no need to maintain that. Our ultrasonic scaler is also maintained once a year. A maintenance man comes in. We also do our general cleaning of Safe 4 and F10ing the whole machine down, every crevice you can see. And then after all that is done, we have our handpiece oil, which we put in, as you can see there, follow the instructions, put drops in, hold for a period of time. And that's just to make sure that these are oiled correctly, the machinery inside doesn't get damaged, and they're safer to use. So that is how we set up for a dental at our clinic.